Good morning. Welcome to NRBP's Eye Opener Addressing Mental Health Needs in the Workplace. My name is Maya Curry. I am the Vice President for Communications and Diversity, Equity, and Inclusion for the Newark Regional Business Partnership. I'm just going to make a couple of quick opening announcements and then get straight to the program. We have 6 successive presentations, which are jam-packed with very, very helpful information about this important topic, and we want to get right to it. So this program is going to be looking at the rising mental health needs and the way that employers can be aware of and provide helpful resources to employees. We have a great panel of presenters who are going to share best practices and talk about some of the work that their organizations are doing to address needs in their own workplaces as well as in their industries. I want to give a quick thank you to our sponsors. Our Eye Opener series sponsor, RWJBarnabas Health, our event sponsor, Horizon Blue Cross Blue Shield of New Jersey, and our media sponsor, NJ Advanced Media. I'm just going to make a quick kind of program format explanation and then get right into our opening remarks from our series sponsor. The program is going to have 6 successive presentations from our experts. After the opening series sponsor remarks, we're going to get right to the presentations. There is a Q&A box that everyone has access to, which you can see in your toolbar at the bottom of the screen. Attendees are welcome to place questions there. Speakers will be addressing your questions written into the Q&A box during the program, and we'll also provide time at the end of the program for some of the questions to be answered live. A quick note that one of our speakers, Allison Mayer-Lakuta, will have to leave the program early. She is with the wellness team at NJPAC, and they're actually having a wellness fair today, so she'll be leaving early to go and manage that. We will be coming back on to address any questions addressed to her following her presentation, but following her presentation, the presentations will continue successively, and we will address remaining questions at the end. I'm going to turn the program over now to Linda Kamate of RWJBarnabas Health North Beth Israel Medical Center to provide opening remarks on behalf of our series sponsor.
Thank you, Maya. So I'm really excited. We're all very excited at North Beth Israel right now. We have a lot of amazing things happening. Last week, RWJBarnabas Health, North Beth Israel Medical Center, and Children's Hospital of New Jersey, we hosted our open ribbon cutting event for our new main lobby. It's really the most visible expression of our Newark Strong expansion project to date. And we started it about 2 years ago. And something else happened 2 years ago that I want to talk about first, because it really speaks to the impact of this project on our community, our patients, and on our employees. 2 years ago, we started the project, as I mentioned, but 2 years ago, Derek Baker got his heart transplant. Let me tell you a little bit about Derek Baker. Derek Baker is a 34-year-old man, has a husband, he has 5 children, and he lives just a few blocks away from the hospital. Now, all his life, he had no idea that he had any heart issues. And then 2 years ago, his wife started having to bring him in and out of our ED and in and out of our ICU. He was in heart failure and he needed a heart transplant. He received amazing care here, and he did get his heart transplant, and he was able to discharge from the hospital. He called his nurses angels, and his doctors and the entire medical team and the senior leadership team. We all clapped him out of the hospital when it was time for him to be discharged. It was an incredible 5 months that really changed his life. But there are so many other Derek Bakers out there. So thousands of families and people who are coming to our hospital every year. And this Newark Strong project is really about creating opportunities for our patients to receive even more enhanced care. I want to show you what the Newark Strong project is doing for our hospital. Let me show you here. Share. Now, as I told you, Derek had to go in and out of our ED. Now, patients, when they come in to our new healthcare Foundation of New Jersey Emergency Services Pavilion. They have a dedicated location to drop off and pick up their family members. I'll advance. We have expanded treatment rooms and more treatment bays for our adult patients. A dedicated space waiting area for our pediatric patients with its own entrance. We see about 95,000 patients in our ED every year. So this is just amazing, the transformation that's taken place. And we have a new geriatric unit. Some people have already been on the unit. It opened last year, and some people may say that it feels like a hotel. It was 2 floors, 24 private beds, and it was designed specifically for the needs of adult patients. And then we have our new CT ICU. And that just was completed a couple of weeks ago, actually. And it is state-of-the-art, created for patients just like Derek Baker and the thousands more that come in just like him, who have to stay in our ICU to receive advanced care. As some of you may know, we are number 20 in the nation for cardiac care. So we have patients coming to us from across the state and across the country really to receive advanced cardiac care. We're also the only lung transplant center in the state of New Jersey. So we have many patients coming to our ICUs to receive advanced lung transplant treatments and advanced lung treatments. And you'll see these new rooms are anywhere from 350 to 450 square feet. They all have either a recliner chair or sleeper sofa, and they have 55-inch screen televisions. So they're designed really for the needs of the patient and the family to accommodate these lengthy stays. And in addition, by the end of 2024, we are looking to have our new cath lab, expanded cath lab open, new hybrid operating rooms, and new general surgery operating rooms, all to support our cardiac and services that we offer here at the hospital. And of course, our brand new lobby. We did the official ribbon cutting last week, last Tuesday. And this, as I said, is the most visible portion of this project. It's a $150 million expansion. And now when you come in, you see this beautiful 17,500 square foot glass enclosed lobby with seating, a community room supported by our Giantomasi, our chairman of our board, Frank Giantomasi, and his family. Outdoor seating as well for our employees, family members, and the community. And it really speaks to what this project is all about. Newark Strong, when we say Newark Strong, it's not only about all of this glass and steel that you see, which is great, but it's really about bringing our community into our hospital, creating a more welcoming space for our patients, for our employees, and for the community. And we've done more than just create a welcoming space. We're also creating opportunities. In the last 2 years that this has been under construction, we've been investing in our local businesses. More than 30% of the spend on this project was invested into local businesses in the Newark area, such as Josloff Glass, which was the local Southward company that actually installed all of the glass that you see in this new lobby, and others as well, MZM Construction and Paul Appliances, to name a few. So we were able to share with all of the people, many of the people who supported us throughout this entire project at our ribbon cutting last week. And I say this all just to say that this project is not just about glass and steel. It's about the Derek Bakers of the world and all of the people that have supported us through this journey. And as we say now, Newark Strong, all are welcome. I want to thank NRBP for giving me this opportunity to share some of what's happening at Newark Beth Israel. And now I'll turn it back over to you, Maya.
Thank you so much, Linda. So that was a great kind of brief overview of some of what's happening at Newark Beth Israel. myself and one of our team members is actually going to be over at the hospital today for a meeting. So we're really excited to see some of the improvements in person, and we encourage everyone to take a stop by or drive through the next time that they're in Newark. We're now going to get straight into our presentations. Our speakers will present in the order here. And following their presentations, as mentioned previously, we will allow for some prepared questions as well as the Q&A from our attendees. So we definitely want everyone to drop their questions into the Q&A box as they have them during the presentations, with, again, the one exception being that following Allison Mayer-Lakuta's presentation, we are going to address questions specifically directed to her because she'll have to drop off of the program early. Our speakers today are Laura Budinnik, Chief Administrative Officer and VP of Behavioral Health for Newark Beth Israel Medical Center, Allison Mayer-Lakuta, Senior Director of Arts and Wellbeing for NJPAC, Rachel Goldberg, Vice President of Strategic Partnerships for NovaWell and Horizon Blue Cross Blue Shield of New Jersey, Lois Green, Chief Strategic Integration and Health Equity Officer for University Hospital, Sonia Nunez, Newark Program Manager for Imagine, a Center for Coping with Loss, and Courtney M. Gacion, member Chiesa Shahinian Giantomasi. I am now going to bring on Laura Budinnik to begin the first presentation. Thank you.
Okay. Okay. I just want to confirm that you can see my screen.
Yes, we can see your screen.
Thank you. Okay, good morning, everyone. I'm Laura Budinnik. I am, by background, a mental health professional psychologist here at the Beth. I am their Chief Administrative Officer and the VP for Behavioral Health. And what we try to do here at Newark Beth, and I think Linda captured our culture well, is we want to address the care and the wellness of the whole person. And really address the family, their needs while we're treating their loved ones. And that is true when it comes to their behavioral health needs as well. So to get us started, and this won't advance, I just want to give an overview of some of the terms that everyone, I'm sure, is familiar with when it comes to behavioral health. So these terms, behavioral health, burnout, mental illness, they get intertwined quite a bit. So just for clarity, behavioral health, when we're thinking of that, it's a broadly defined set of issues that are the scientific study of emotions, behaviors, and biology as it relates to an individual's mental well-being and their ability to function in day-to-day life. So it's a continuum, right? It's one's emotional well-being, if you want to think about it that way. Burnout is different than that, and it's a state of emotional, mental, and often physical exhaustion brought on by prolonged and repeated stress. Usually it's work-related, but it can be associated with other areas of an individual's life, like parenting, caretaking, or relationships. Burnout is often triggered, and this is where it becomes important for us as employers, when a person is not in control of how a job is carried out at home or at work, and when the tasks that they're given to carry out conflict with their sense of self. So if you don't connect with your tasks that you're needing to carry out and who you are, you're at risk for creating some sort of sense of burnout. Then finally, there's mental illness. And mental illness can be acute or chronic. They're diagnosable conditions that affect an individual's behavior, emotional, and social well-being. Mental illness is the qualifier that symptoms and a condition interferes with your daily functioning. So in order for you to have mental illness as a diagnosis, one of the underpinnings is that the symptoms you're experiencing are now interfering with your daily functioning. So you may have symptoms that are related to burnout that impact your behavioral health and your sense of well-being, but they may not meet the criteria yet of a mental illness. It's a spectrum when we think about it. So I also want to talk about prevalence and what is the prevalence of mental illness, burnout, behavioral health symptoms happening around us. So COVID, I'm sure everybody is aware, impacted a lot of things. It did impact workplace behaviors. It impacted one's sense of safety, wellness. And in 2019, if we go back before COVID, approximately 1 in 10 adults, or 10% of the population, reported symptoms of anxiety or depressive disorder. So symptoms. Since May of 2021, post-COVID, we're at 3 in 10 adults who report those same symptoms. So we've increased by 3 times, and we're 30% of the population that are experiencing some symptoms. Maybe not the full illness or diagnosis, but the symptoms are there, and they will come up day to day and have different sorts of impacts. In the US, approximately 1 in 25 adults, or 4% of the population, experience a serious behavioral health issue in a given year that substantially interferes or limits one or more major life activities. So if you go back to the definitions, that's about 4% of the population in the US for adults that's impacted by a diagnosable mental illness. And approximately 1 in 5 youth aged 3 to 18, or a little over 21%, experience a severe behavioral health disorder at some point during their life. And for children aged 8 to 15, that's at 13%. So these are significant portions of our population that are experiencing some sense of an illness or at least symptoms. So disparities. We know about disparities in healthcare outcomes. Let's talk a little bit about the disparities when it comes to mental health services use and access. So in the US, access to behavioral health services is available in a variety of settings, but not everybody pursues them at the same rate. African Americans and Hispanic Americans each use mental health services about 1/2 the rate of white Americans, and Asian Americans are about 1/3 of that rate. However, the incidence of mental illness, we don't see a disparity. The human condition of symptoms of depression, anxiety that can advance to a mental illness, it's not deviated by race. We see it equally across the board. Bias and stigma has a place in all of this too. So half of all chronic mental illnesses begins by the age of 14. That's a really early onset of a condition, and 3/4 of all of it begins by the age of 24. So despite effective treatment, there are long delays, sometimes decades, between the first symptoms or appearance of symptoms or discomfort and someone pursuing help. Even admitting the presence of symptoms associated with a mental illness prevents people from getting that available help. And we see that here at the hospitals and in healthcare settings. We know that the rate of positive depression screenings on validated scales is about 5%. And because at Newark Beth, we are concerned about your total wellness, when you come into our services, we do screen for issues of depression, and we expect to see a rate of 5% since that's what occurs in the population. But when we're asking our patients, only 0.5% confirm the presence of depressive symptoms. Sometimes that's just, they don't want to admit it. That's not why they're here. It's too uncomfortable to admit it. And sometimes it's the way in which we ask a question. So oftentimes when we're asking questions and we don't want to intrude too far into someone, and this is true for employers and for healthcare settings, we might ask a question such as, no history of depression, right? You're not feeling any, you're not having any thoughts of harming yourself, right? You're safe at home, right? So we're asking people to confirm the lack of symptoms rather than just leaving it open-ended. And that will tell a patient or an employee that you want them to answer the negative, that they don't have these symptoms. Psychological safety. This is another issue that I think for employers is very important, and some terms around this. So psychological safety is a belief that you will not be punished or humiliated for speaking up with your ideas, questions, concerns, or mistakes. When you think about employment and your place in the workplace, psychological safety is a huge driver of employee retention, creativity, and innovation. If you're not feeling safe enough to take a risk and bring up a new idea, or maybe counter an idea, challenge a thought, you're not likely to bring it up and say anything. So you're really squelching the creativity of your industry and your employee. And often those are the employees that look to exit. When we look at differences in gender and psychological safety, it is more often women who don't feel safe in the workplace when they do surveys. There was one survey done by Forbes in April of 2021, and 1/3 of women of color were ready to leave the workforce and cite burnout as a lack of psychological safety, along with a desire to change their career paths and search for a greater purpose. This really speaks to the mitigation strategies and intentional, deliberate acts that we need to do in employment settings to have people connect to the tasks that they have. It will not only prevent burnout, but it will improve retention, it will improve creativity and innovation, and it'll keep your staff feeling like what they're doing has meaning. When we look at things like employee engagement here at the hospital and in any setting, activation and decompression are two important components of employees feeling engaged in their work. So activation is feeling connected to the work you do, that it has meaning, that it relates to your personal sense of self. And decompression is the employee's ability to disconnect from tasks at work and pursue other maybe socially related or pleasure related activities. And they can disengage from their thoughts when they're not actively having to do a work task. Both really important when it comes to retention in the workplace. Outcomes. What are some of the outcomes that we've been seeing? So adults in the US living with a serious mental illness, and this can be at any point in their lives, we see that they die 25 years earlier than others, and it's largely due to treatable medical conditions. There is an awareness that the persistent mental illness, or even the acute but transient mental illnesses that one might experience, they prevent people from seeking medical services or following up. So something that is treatable, that is a medical condition, may not get addressed early, and it may not be addressed consistently because of some of the emotional and thought disturbances that someone is having when it comes to pursuing medical care. There's also the issue of suicide and self-harm, and it's the 10th leading cause of death in the United States, and it's the second leading cause of death for individuals aged 10 to 34. We keep seeing the age of completed suicides drop year over year. Recently, it's become most accelerated around young girls that are completing suicide at an early age. And we see these things in the news, and we know there are issues around bullying, and which goes to psychological safety and just the lack of getting help. Because if you remember the statistic, it takes some time from the first symptom to present itself to someone to present for help. So a lot of our employees who have children are also dealing with this issue and the awareness of resources. The good news is in New Jersey, there was a study done for those who did receive treatment. And of those who did receive any form of treatment for their mental health symptoms, 94.1%, that's a huge percentage, reported improved functioning as a result of their treatment. So treatment in itself is key. So what does this mean for us when it comes to promoting care for our employees? And you're going to hear a lot of different discussions today about different things people are doing. This is going to be a more broadly based discussion just touching the service. So formal treatment and therapy, EAP, employee assistance programs. These are the formal programs that we offer our employees when it comes to issues that are related to either work-based concerns that are impacting them or their behaviors. And here we offer EAP for any concern to the employee or their family member. It should be easy to access, it should be quick resulting, and it's private and not provided by our own staff here at the hospital. We have a separate vendor, so this way the staff or their family member can feel that it is truly private and separate, but a benefit that we offer to them. There are employee medical benefits, of course, where someone wants to pursue longer term treatment than what EAP could maybe provide, but we offer many behavioral health services and providers through our medical benefits. Oftentimes, in the past, we've seen a disparity between what the medical benefits are in a plan and what the behavioral health services are in a plan. And I believe that that is getting better. We're not completely parallel yet, but the awareness and availability of mental health services through medical benefits is definitely getting stronger, and the awareness of its significance is definitely growing. Then there's human resources, offering accommodations to employees who are experiencing a difficulty. It may be something that's traumatic and outside of work. It may be something that's related to their work, but really trying to keep people engaged and finding their work meaningful to their overall quality of life. Those accommodations become key to partnering with the employee so that they're feeling that you are a partner in their wellness and they're moving forward. Then there's the therapeutic activities. These are the ones that we can do. They don't require benefits. They don't require a diagnosis. These are activities that can help our staff and our managers and our own selves stay healthy and connected. So here at the hospital, I'm going to describe one to you, and they may be relevant for you. And if you have questions about how they could be relevant in your workplace, I'm happy to entertain them later in the program. This is healthcare. Our staff participates in a lot of very emotionally impactful events with their patients and with each other. We see life and death occur here at the hospital. When our staff is impacted emotionally by a critical incident, and all a critical incident means for us here is it had an emotional impact on our team, we do debriefings, which are not meant to be therapy sessions. They're not meant to be operational critiques of how care went. They are totally meant to support the staff in processing the emotions that they had as a team and to get them back to optimal functioning while connecting them to further resources if that's needed. Emotionally impactful events are inevitable in all of our lives, and helping people normalize their experience and connecting it to the event they were in really helps people normalize what they're going through, not be fearful of it or feel that they can't discuss it or disclose it. It's an opportunity to really talk about how we all share similar experiences when we all share an event. And these things can happen to our employees at work in any given situation. So there is a huge opportunity there for us to provide supports to our staff when something is emotionally impactful. Then there are organized social events. Here we have business resource groups. These are groups or organized events that people take part in voluntarily. It's things that interest them. It may not be related to the day-to-day job that they have at work, but it helps them connect meaningfully and emotionally to their workplace. So we have a lot of different clubs, business resource groups that really bring about, one is culture, and it really is about celebrating various cultures and different lunches and activities that we provide across the hospital, because that's what some group of employees feels very connected to, though it might not be connected to their day-to-day work. It gives them a place at work to connect to what they do. We do a lot of physical activity here at the Beth. We are a tall building. I'm sitting now on the 12th floor, and there are different pockets of departments and staff that do stair walks every day as a group, just so that they are organized and getting physical. We do walks in our community where the lighting is good and we have the opportunity in good weather to be outside in the community. We want to help others as an employee group. We have a social conscience. We want to take part in the things that happen in our community. And that's a lot of what we put into our Newark Strong initiative, so that we are working with our employees in the community. We have creative spaces. They're called comfort rooms in some departments. They're a place where you can kind of separate, decompress, and kind of just socialize with your colleagues as you need to, or be on your own if that's what you need. And then there are culturally based healing circles. I can give a little bit more information on that if there are questions around it. They're really not based in a therapy activity, but they sound like what they are. You are in a circle and you're sharing different experiences as a group, and it could be a department or it could just be people with similar interests in your workplace setting. And then here at the hospital, we do something called Schwartz rounds. We're doing our next one this Friday. It's well attended. It's meant to provide care to the caregiver, where people come together and talk about an issue that impacts all of them. It may not be a critical incident, but it's impactful to them, and they can all share and relate to a similar experience. This time, our discussion is on the power of apology. You know, what does it mean when you're giving or getting an apology? And I'm facilitating the panel on that this Friday. And I met with 4 people yesterday who each had very different stories that they'll present in the panel, but they're all related. And the rest of the staff who will participate, about 50 people, will also bring their own thoughts and feelings based on the panelist discussion. It's another opportunity to connect and feel that what you do in your workplace makes meaning and you're similar to your colleagues. So with that, those are some of the formal and informal therapeutic activities that we can do. As I mentioned, treatment is essential, even when it's just the first indication of symptoms, and the younger we can get someone to address those symptoms, the better their outcomes are, both for their mental health and their medical well-being. And I will leave it, I'll share some references, and they will be in the PowerPoint that gets shared with the group if you have any additional questions or want further reading. And I will pass it along to Maya for the next person to present. Thanks so much for your time.
Great, thank you, Laura. We're going to go right into Allison Mayer-Lakuta's presentation.
All right, good morning, everyone. I am Allison Mayer-Lakuta. I am the Senior Director for Arts and Wellbeing at the New Jersey Performing Arts Center, or NJPAC. And I'm here to talk about arts and creativity as a tool in your toolkit when addressing mental health in the workplace. And so I usually like to start off with a little bit of background. You may think arts and well-being, what does that have to do with each other? But it's based in a field called arts and health, which is a field of research and practice and education growing around the globe. And I have the technical definition on the next slide, but the 2 basic tenets that I hold on to are that everyone is an artist. Everyone here, whether you define yourself as that, whether you're on stage here at NJPAC or doodling during a Zoom call, and that arts and culture are actually integral to our health and well-being at all levels, individual, community, and population health. We've been using art in our healing practices to make meaning in play for all of human history, and we're still doing that today. So it's got to be important, right? So you can see here the technical definition of the field and the kind of spheres of impact, whether you're singing in the shower or writing public health policy about using the arts for vaccine confidence. There are various kind of intersections for arts and health. But the touchstone that I like to come back to is that, like exercise and good nutrition, the arts are good for our health. And how do we know that? Well, besides the good feelings that we have, feeling better when we leave the theater than when we walked in, or better after a dance class than when we entered, there's actually a rich, rigorous, peer-reviewed evidence base that looks at arts engagement over our lifetime and the benefits thereof. So we see that arts engagement is associated with an increase in positive health outcomes like self-efficacy, emotional well-being, life satisfaction. Communities experience greater social cohesion and civic engagement. And then we see decreases in negative health outcomes or behaviors. And so we see, especially for youth engaging in the arts, lower rates of depression, loneliness, social isolation. We see lower rates of behaviors that are purported to be antisocial or get criminalized in our classrooms. We see lower rates of substance use trajectories. And across the lifespan, we see that lowering of loneliness and social isolation and lower early mortality. I love this stat too, that if you attend a concert or go to a museum just once or twice a month, it has similar protective value to your health as exercising for an hour or 2 a week. although all the doctors in the room will say, don't put away your gym bag just yet, but do both, right? So with all of this information, NJPAC has launched a new initiative called Arts and Wellbeing. And our big ideas are that just by the work that we do, that performing arts centers are community health centers. By providing arts, by giving access to the arts, we're making an impact on the health and well-being of our community. Also, thinking about that data about youth engaging in the arts education is really a public health priority. When we think of those upstream drivers of health that can impact trajectories over a lifetime, having access to the arts for our youth is of paramount importance. And also that arts and culture are essential social services, which means that, again, access is really important. And so as we think about what we're doing externally through arts and well-being, and I'll talk about two of the pillars that we're working on today, we also think about reflecting that back into how we care for our staff here at NJPAC. And so we have a large group of employee resource groups and affinity and resource groups. One of them is the Wellness ERG. And so we focus on the wellness of employees at NJPAC really holistically. Like Laura said, like whole person care, right? So we look at these 8 dimensions of wellness and see how we can bring in speakers and resources to give to our employees to impact those 8 dimensions of wellness. Excuse me. One of the resources is our Zenden, and another that I'll mention is our wellness fair that Maya mentioned up at the top, which is today. The Zenden at NJPAC is similar to the kind of respite room that Laura was mentioning for the healthcare workers. It's a space here on campus that we've established for our staff to take a break during their workday. And we've emphasized, don't use your lunch break, use your lunch break for your lunch, and then carve out an additional 30 minutes to come into the space and rest and rejuvenate. So employees enter, they can follow the QR code link to find YouTube playlists with meditation, with yoga. You can see one of our development staff, practicing on the yoga mat there. And a host of creative activities too. So whether it's mandala coloring, watercoloring, origami activities, it's a place for people to kind of get creative and relax. And then our wellness fair is public for the first time ever this year. It's an annual event that typically was just for our staff. And this year it's different in 2 ways. One, it's public, it's open to everyone. You can stop by from noon to 3 today. And the second way is that we've woven in creative resources along with our health resources. So in the same event that you can access, your blood pressure screening and glucose screening, shout out to RWJ Barnabas and Horizon as our kind of healthcare anchors for the event. You can also stop by Elevate Theater Company's table and learn about theater productions that have public health messaging, or New Jersey Symphony's table to learn about their music and wellness program. So we've woven in these creative resources along with the health resources because they are really tied together. So I'll move now to the 2 pillars that are happening outside of our walls and into the community. So the Arts and Wellbeing Initiative at NJPAC is endowed by RWJ Barnabas Health and the Horizon Foundation for New Jersey. And so one of our core pillars is arts and healthcare. So weaving the arts into the healthcare system at RWJB. And we're using Newark Beth Israel as our test kitchen here. So we're starting with artists and residents who will be working bedside with patients. We're starting with the inpatient pediatric unit, and we have our eye on oncology and serendipitously heart transplant, or the transplant units as our kind of expansion steps next. But so musicians and visual artists and creative writers will work at the bedside with patients to relieve stress, to distract from the environment at hand, and to just improve their well-being overall and improve the patient experience. These are not creative arts therapists, so we're not providing any clinical mental health services here. We're providing holistic health services here. We're also going to be programming, Jazz in the Lobby series, and for the cultural events that the BRGs produce, linking artists to perform at those events too. And this is not just patients facing, but for the staff as well. We've developed programs that staff can use to build resilience in the face of burnout and stress, and then also process grief and stress too. So prevention through treatment, and also things like education, observation, and cultural competency through the arts. One thing that we hear a lot from providers is that, in a 15-minute visit, it feels impossible to give patients all the tools that they need and really connect them with all of the resources at hand. And so the next pillar I'll talk about is trying to expand the toolkit that providers have. And so it's Arts on Prescription. We are partnering with Horizon's Neighbors in Health program to give their community health workers the ability to prescribe local arts and culture to the members that they receive. So these members are receiving referrals for other social service needs, either mental health, housing, food, transportation. And the community health workers are engaging in conversations like, what keeps you up at night? And this gives them an opportunity to also ask, what brings you comfort? What brings you joy? What keeps you well? And connect folks with our abundant arts and culture resources here in Newark. So we've built a consortium of arts partners that will be a part of this. So folks can receive either, a free ticket to a show at NJPAC, a workshop at the Newark Museum of Art, go to soul line dancing at Symphony Hall, or attend a mosaic class at Glassroots, just to name a few. So we're really kind of increasing the toolkit using our kind of rich, vibrant arts resources that are here in Newark. And we really see this as a way of, improving access to the arts for folks who might not have it in the first place, or might not see it as kind of an opportunity to improve it and bolster their health. And so I know our time is short, so I'll wrap it up here. But I just hope that as I leave you, I hope that when you think about the resources that are available for you to bolster the mental health of your workforce, your employees, that you think of the arts and culture resources that are here at our fingertips, whether that's going to the library, setting up a glass blowing workshop, tickets to NJPAC, go to a soul line dance class. These resources are really vibrant here in Newark, so I invite you to use them.
Thank you so much, Allison. It was really great to learn about what's happening at NJPAC, the new programming centered around healthcare, and we look forward to hearing more about it in the future and hopefully engaging with it ourselves. As I mentioned, Allison is going to have to leave us soon so that she can go manage today's wellness fair at NJPAC at noon, which we encourage people to attend if they're in the area. I did want to just provide a quick opportunity for any questions. I don't see any questions in the Q&A box at this time. But I'll give it another couple of seconds if anyone wants to drop anything in. I do want to make sure, Allison, we had a couple of prepared questions, and there are two that I'll just kind of make it a point to pose to you before you leave us. What are, from your perspective and in your experience in your industry, what are some best practices for dealing with and addressing traumatic events, such as mass shootings or other instances of violence, which may impact individual employees or the workforce as a whole? So some of these kind of mass events that are not specific to individuals, but that really have an impact on us all.
That's a great question. I would say first, to make sure that you have the appropriate resources at hand. For something that's really traumatic and could be triggering for someone, you want to make sure that you have a professional on hand, whether that's a counselor, social worker, a mental health professional who it's within their scope of practice to address these issues. And then secondly, I would say, the arts are an incredible vehicle for communication and processing, and they allow us the full range of human emotion, right? Like often, you come to work, you go through life and people ask you, how are you doing? How are you? And really, we're only allowed to say fine, right? Like we're not really inviting an honest answer. But when you can access the arts and use creativity as a tool for more honesty, we can allow people to really be honest about everything that they're experiencing and let us own that as the human experience in a safe space with those mental health professionals present.
Awesome. Thank you. I think that was a great answer and to the point. And then the second thing I just want to make sure to ask you specifically is, what is one takeaway that you just want to make sure that the audience leaves with? So whether it's about arts and well-being or whether it's just about this topic of mental health as a whole.
I think for me, there's maybe two things that, one, the arts are an available and underutilized resource for us. And when we think about mental health, or when I think about mental health, I really think about a continuum of care, that it's something that we can use to build resilience so that when we experience something traumatic or hard in our lives, that we have more tools in our toolbox to cope with these things, right? And so it can prevent a crisis, a mental health crisis, from happening if you have a robust kind of toolkit in your pocket. And I think, the arts are not a panacea, but they are an important part of the overall kind of toolkit that we can build for ourselves.
Great. Thank you, Allison. And I think kind of in line with what you're saying, someone said to me recently, you have to give yourself things to look forward to. And the arts are certainly something where if you're going to a show or a play or you're going to see some kind of have an artistic experience, I think that's definitely a really pleasant thing to look forward to. So thank you for presenting. I think Allison will be on the event for a few more minutes once we switch over to the next speaker. So if anyone does have any questions, again, just drop it in the Q&A box and she'll be able to type an answer in there for you. Thank you, Allison.
Thanks,
So
Maya.
we're going to continue through with the remaining 4 presenters. I'm actually not going to come back on camera again until the end. Our next presenter is Rachel Goldberg from NovaWell Horizon Blue Cross Blue Shield of New Jersey, which is actually a partner of NJPAC and their wellness programming. Following Rachel, we'll have Lois Green from University Hospital, Sonia Nunez from Imagine, a Center for Coping with Loss, and finally, Courtney Gassioni from Chiesa Shahinian and GM Tomasi.
Hi, Maya. Can you hear me?
Yes, we can hear you. Yep.
Excellent. Thank you. Well, thank you so much for the opportunity to be here today and for allowing us to be a part of this really exciting presentation. I'm Rachel Goldberg. I'm responsible for strategic partnerships and product innovation at Horizon Blue Cross Blue Shield of New Jersey, specifically related to behavioral health, and hold the same role at our new affiliate organization, NovaWell, which is supporting health plans in other parts of the country to achieve the same results that we have in New Jersey and to support their behavioral health programming and strategy on behalf of their members. So I am so happy and thrilled to be here. And obviously we're so happy to support the NRBP and NJPAC. And it was so exciting to hear about the amazing work that's happening there. We too totally agree and believe that care not only needs to happen on a full continuum, but that there need to be non-clinical supportive services that help people feel better. And the arts is certainly a really important aspect of that. And it was really great and interesting to learn more about what NJPAC is doing. So Laura at the very beginning gave some statistics about what's happening in terms of mental health in the country. I wanted to lay this sort of this framework for you all to understand how we think about our overall strategy here at Horizon. And obviously, we're responsible for supporting and taking care of almost 4 million members in the state of New Jersey, but we also have a great responsibility to our employees to make sure that we are really walking the walk related to mental health and awareness and stigma reduction, et cetera, so that our employees feel better, so that they can help support our members to feel better too, and really push this commitment to stigma reduction and mental health awareness throughout the state of New Jersey. So again, the statistics at this point are really eye-opening. Obviously, as Laura said at the beginning of the presentation, significantly more people now are showing symptoms of anxiety, depression, other mood disorders than previously reported. That's all of us in this room, our family, our friends, our colleagues, et cetera. Unfortunately, though, stigma is still alive and well. And as a result, 67% of people with a behavioral health condition will never actually seek treatment, which is a horrendous statistic. And the same would not be true, right, if you had a headache or any other physical health chronic condition. So it's really important that we're continuing to push awareness and reiterate that mental health conditions and substance use disorder are chronic conditions just like any other physical health ailment, and we need to get help. In terms of access, obviously the entire country is in the midst of an access shortage. 120 million people in the country live in a mental health professional shortage. We cannot make psychiatrists quickly enough. We just cannot birth them. So our overall goal at Horizon has really been to think about changing the dynamic in the ways that people are accessing care, and not only increasing access and growing our network, which we have at this point by over 90% in the last 3 years, which has been really exciting, but to also better empower our physical health network to support our members, and to think about non-clinical supportive services and self-care resources that can be deployed to members who maybe don't actually need clinical formal care. And on the quality front, this is a pretty scary statistic, but 50% of patients with a latent behavioral health condition end up being accurately diagnosed, which means that 50% of people are not accurately diagnosed, which means that those 50% of people, if they're receiving care, are probably receiving care that's ineffective for their particular need. So we have a great duty and responsibility here in New Jersey, obviously, to work within the healthcare system to change these statistics. But certainly people with mental health and substance use needs, which again could be all of us, end up typically having more medical claims and more ER visits and more challenging quality of life as a result of the comorbidity. So our entire strategy is focused on combating, all of the challenges within the behavioral health system, but these as our primary anchors. So what are we doing to support our employees? Obviously, we've launched a lot of programs for our members, but we knew we needed to start at home first and really make sure that in order to drive this culture of integration in the community, and reiterating with all of our physical health providers and our behavioral health providers too, and all of the other organizations that we work with, that not only is mental health, but just the way like our brain is attached to the rest of our body, we need to really think about caring for people as, full people and not just this set of conditions. So internally at Horizon, we are constantly promoting this culture of integration and mental health awareness as a way to really walk the walk and promote what we say. So aside from the fact that all the programs that we made available to our members are also available to our employees and pushed, we do a lot of different types of trainings around the importance of integration and stigma reduction in general. So lunch and learns, there's a new affinity group at Horizon. There are a variety of affinity groups to sort of bring different groups of employees together to promote specific topics. And we now have launched one specifically for employees or family members of employees, or even just allies of employees who have either physical or non-physical types of disabilities as a way to really talk about sharing our stories and reiterating the importance that everybody has a story that's important to be told. We also recently, well, in the midst of the pandemic, did mental health first aid training, which is a pretty rigorous course for a subset of employees who were non-clinical in nature, who were interested in learning more about how to understand the signs and symptoms of an employee who was having a mental health challenge, to be a better sort of advocate for those employees rather. And we now have 2 employees trained as formally trained mental health first aid trainers, so that they can continue to reiterate the message internally. Obviously, Horizon HR and Laura mentioned all the different sort of traditional resources that are typically available, but aside from EAP and sort of the more traditional HR related programs that have been made available, we have also continued to promote a variety of different virtual and digital mental health and substance use disorder services for our employees and also for our members at large. And starting on January 1st, we released this new sort of digital front door, and that's really what we'll show you today. But the goal of the digital front door has been, there are so many different solutions that have been deployed for our employees. And it was important for us to make sure that they were all very easily found in one place. And we'll show you what that looks like in a moment. So our front door includes hundreds, if not thousands, of different pieces of content across all mental health related conditions and non-mental health related conditions. So there's information about spiritual health or how to handle political crises, information about like events that are happening and how to deal. As well as like the impact of physical health on your mental health, courses about parenting, lots and lots of different pieces of information. And the goal has been, if we think about that original statistic that 67% of people never actually access care because of stigma, we wanted to arm our employees with information so that once they do feel that they are equipped to ask for help and they feel brave enough to ask for help, we can then easily support them to get into that help. So in addition to the evidence-based self-care resources, there are a variety of different assessment tools that help our employees better understand how they're feeling in a non-clinical way. As well as a proprietary assessment tool that we've developed that then helps the member to pick which in-network solution would make the most sense for their particular clinical need. So this is what the site looks like through the internet, and it's also available via phone so that we're giving people options. This is an example of the different topics that are available and all the different types of tools. And what we've heard from our employees, we've been doing satisfaction surveys and just trying to gather information from them. They're very impressed not only with the fact that Horizon has sort of thought outside of the box in terms of reiterating information and reiterating our mental health awareness, but they also now feel like they're better equipped to handle their own needs, which is exactly what we were hoping for. So the assessments, when a person takes the assessment, it then shows areas of need, and then in a very sort of friendly and non-intimidating and non-sort of formally clinical way, helps to explain the results to a member, and then again points them in the right direction. So we're really excited about having launched this. Our goal obviously is to launch it for our own members also, to give them tools and tricks essentially to handle their needs in addition to all of the other opportunities that are available in New Jersey to support their care. And this slide looks very silly and I apologize for that. But this is an example of how the different resources are made available and helps to point the member in the direction of the clinical care that they have as employees of the company and as beneficiaries of the Horizon benefits. And that is what we're working on. So thank you so much for the opportunity. And I will pass it to the next presenter.
Great. Thank you, Rachel. So now we're going to bring on Lois Green from University Hospital.
Apologies. Can everyone see my screen?
We can, but you should put it in presentation view because we can see all of like the
Got
sidebar.
it. Okay. Is that better?
Yes, perfect. Thank you.
All right, great. I am Dr. Lois Green, and I'm from University Hospital, as was stated earlier. And I am just grateful for this organization who gives us an opportunity to have this conversation about talking about what are we doing, how are we as employers addressing mental health in our workplace. I want to frame this with, we came through 2020, and this saying just says, because without the dark, we never see the stars. And one of the things I think that 2020 taught all of us was that there was a lot of opportunity to do things differently and maybe better moving forward. So it wasn't all bad. I say that there are many, many pearls that have come out. So a little bit about University Hospital. So we are New Jersey's only public academic health center. We are committed to providing exceptional care to every patient every time. That's our mission, right? So it's a noble mission, and I thank you for that we connect.
Dr. Green, I apologize. Your audio is going in and out. Do you want to try to call in for the audio portion?
I can do that. Can you give me the number?
Yeah, sure. Give me one quick second.
Sure. Apologies, everyone. I think I need to switch. I will keep talking just to see if, until I get the number. Can everyone hear me now?
Yeah, yep, we can hear you. It just goes in and out a bit.
Okay, how's this? Is this better?
Yeah, I think we may
Okay.
be good. I'll drop it into the chat for you just in case, but we may be good.
All right, I'll keep going. So our vision, partnering with our communities, that we want to improve health for generations to come. So connecting our mission and our vision with our workforce and our community has really been an important part of it. All right, can you hear me now?
Yeah, give me one second. Because as a panelist, you just have a unique participant ID. So I'm just pulling that up for you.
No worries. So just so that you know, our workforce sort of mirrors our community. So when you look, from 2018 to 2023, our workforce from the greater Newark area has been a majority. So as I'm talking about what we've done and how have people been impacted, you just know that our workforce really does represent the community. So who do we serve as University Hospital? There's about 27 zip codes where 80% of our patients and our come from, and that's this greater Newark area, as it's called, and about 9 zip codes make up for most of the patients that we serve. So what are we seeing? What are the issues that our community, and when I say community, I'm saying not only the Newark community, but the workforce, the patients, what are they seeing? So from our community needs assessment, it was observed that some of the challenges in Newark mirror what is in New Jersey, what's in the nation. So, going through 2020, COVID-19 was one of our major challenges, but what we also identified was that heart disease was also significant, right? So cancer, when you look at heart disease for Newark, it's number 2 versus number 1 in the country. We were impacted by COVID-19 definitely more significantly in this area. So just seeing how we rank. Cancer and malignant neoplasms, it's important to know that it does mirror the nation. It did not go over COVID-19. When we look at stroke, probably more significant for New Jersey, it's dropped. Diabetes mellitus is something that is impacting the Newark community and our employees even more than the nation. So important to know that. Is my audio okay? All right, so what are the other things that our workforce is dealing with? So when we talk about the health issues, smoking, I think we all have smoke-free campuses, but it is still significant, where it's 13% in New Jersey. In Newark, it's a 21.9% occurrence. Excessive drinking, physical inactivity. One of the challenges with COVID is that people were not getting out, they were staying home, people were very much afraid. So all of those challenges that go with decreased physical activity continue for our workforce as well. Believe it or not, food insecurity was something that we even saw in the workforce because of the different ways that people were laid off. And sometimes you might have a nursing assistant that's the primary breadwinner for her family. So food insecurity did not pass our workforce by challenges. Mental distress, you see, and physical distress, drug overdoses. Many of our employees live in this community, so there were employees that were dealing with death at home and dealing with violent crime. We all live in a higher crime rate. You see it 619 per 100,000 versus 253 for New Jersey. Right. So these are significant issues that maybe.
Dr. Green, I apologize.
Yes.
I think, so I
No.
did send you the number and your participant ID. I think you should definitely try to call in because it's continuing to kind of go in and out.
Got it. Okay, no problem.
So we'll just take a
Which
quick
audio?
second to allow for that. Yep.
Sure.
Welcome to Zoom. Enter your meeting ID.
Just, Dr. Green, are you back with us? Okay, we can't hear you. Okay. All right, apologies for the technical difficulty. We will be back in 1 second. Okay, I think that's you. Okay, I'm trying to ask you to unmute. I believe
There
this
we
is,
go.
okay, here we go. Perfect. Thank you.
Can
Sorry about
you
that.
hear me now? Okay, no worries. So I can be heard better now? Is that better?
Yes, I think we're good. Yes.
So what were the identified themes? What were the things that our employees were concerned about? Certainly accessibility of healthcare. Sure. COVID-19, the prevention impacts, and we'll talk a little bit more about what we did as an employer, how substance use, racism, discrimination, food insecurity, access to talent. Many of our employees were working significant hours, and it's still a comfort or an access issue. Certainly, mental health issues were significant. Family support. So what was happening in UH? So certainly, I think we were not, unique in that staffing challenges hit the country, hit the nation, right? So we had multiple areas where there were significant staffing challenges. We also, once you had had patients that were now trying to access care, physician shortages, and being able to timely appointments for subspecialties, and someone mentioned psychiatric care. We are all experiencing that. But it wasn't only nursing and physicians, certain allied health areas. We recognized that there were challenges in radiology and in many of the allied health areas, and it continues to be a challenge, right? So during all of this, New Jersey became a state where marijuana was legalized, and there are no formal ways to be able to test for it as an employer. How do we manage this? How do we manage training leadership as to what an impaired employee might look like, and how are we making sure that we're equitable, to our employees is a significant thing. Clinical burnout, one of my colleagues definitely mentioned that. And if you are not connected to the work, if you are disillusioned, there were many, many people that left healthcare and have not returned because of the disillusionment, because of, I didn't sign up for this. So we saw some of that. The question was, are there differences in the care needs of staff by job title? And we did provide many support services, and I'll share them with you a little bit later, but we did see that who would access them was really dependent sometimes on the role or their perception of how they might be viewed if they were to access services. So making sure that we could have employees access services confidentially was a really important. And everybody was stressed about different things, right? And they continue to be stressed about different things. So there are unique needs that we have to address and listen to as an employer. What are the support offerings? And I really lumped them into 4 categories because this was what was significant to our employees. They wanted to make sure best was that they received information, right? Information support. So that might be, how are we communicating, changes in the environment? How are we communicating shortages? Do we have the right trainings and guidelines for employees to do their, implementing prevention programs? How can they be healthy in the midst of caring for other people? Then there was what I categorize as instrumental support, right? It was a great stress and can be a great stress to employees if the PPE is not, they don't have their sides of N95 or, the protection protocols just keep varying. What do we do to stay safe? So making sure that there's instrumental support. And then organizational support. We had to hear what are the concerns of our employees, right? So they wanted to make sure that manpower, we're doing everything that we can to get them the support that they need. We were really creative and flexible in working hours. There were some employees who were able to, because of childcare issues or caring for elderly parents, needed flexible work hours where we could do that. Some shift variance, any way that we could provide organizational support that would continue to support them in achieving our mission was really helpful. The other organizational support is recognizing that everything that was going on in the world, how do our facilities, how do our structures support both their safety, both their, their ease of coming in and out of work. So we actually had to did implement, a weapons detection system. And then making sure, and I heard one of the earlier speakers, looking at creative areas. How do we provide for their rest areas? We put a well-being room in, has a massage chair, it has, access to, music and aromatherapy, those kind of things. So they can get a break from the work. And then emotional and psychological support was really critical. So making sure that we recognize that, we're taking care of the people who are going through this, but we also are providing care for the caregiver. So there were a myriad, and many of the things that were mentioned earlier were helpful. So stress management, we could provide, nurse to nurse, and I'm sorry, slide it. Stress management support, resiliency tools, how can they, manage their own anxiety. There were support around mental health and coaching, employee assistance programs, and making sure that we had a high quality employee assistance program was really good. It wasn't really helpful if, they tried to access it and their appointment was going to be in, 10 weeks. Short round, somebody mentioned being able to have repasses, have chaplaincy, give support to being able to debrief after a traumatic event. We developed peer support trainings so that you could have someone that understood what you were going through at your level. And that was really critical for our physicians to open up to other physicians, for our nurses to open up to other nurses. So we circulate these resources regularly. One of the things that I think is kind of unseen in the hospital is sort of the increase of violent events that were happening. So I mentioned the Handle with Care training. Much of that is, communication training. How do we de-escalate situations? How do we manage a situation so that employees are safe and patients are safe? When you look at the location of violent events, the hospital, certainly our emergency department colleagues have a lot to deal with a majority and the bulk of that occurring in their workspace. Our behavioral health events, the significant increase in behavioral health concerns and mental health, sort of people tipping over has been something that we have viewed as an organization and increasingly try to manage the resources to support the needs of the community. So all of this in the midst of making sure that we have an equitable and inclusive environment, that we are setting our priorities around the human experience. And when I talk about the human experience, I'm talking about, we used to really focus on, what are our patients experiencing, but the focus probably in the last 4 to 5 years has been on, right? So we serve our patients, but they have families that have needs. Our community has needs and our employees have needs. And we have a rich history. And I like this picture because a lot of who we are and what we're doing is based on the Newark Accords and the commitment of the hospital to the community, that we are going to consider equity and inclusion priorities in a real intentional way. So we're looking at our policies, our patients and their families, what are their support needs, the community, how can we best serve? There's a lot going on in the community. And as a partner, we have to be able to address and meet the needs of those, as well as our team members and our suppliers and vendors, right? So we are not only an employer, but we're also a purchaser of many things. So our equity and inclusion journey is one that, and I'll just give you this. So even in the midst of COVID, we actually started an equity and inclusion steering committee that consisted of our employees. And we needed to hear from them. So surveys were given. We did a round of surveys. So it wasn't only patients, it was community partners. And then we began the journey, right? So we had to assess our workforce, be intentional about who was going to drive us, making sure that we have a commitment to equity and inclusion perspectives. And there's a verbal as well as a written commitment. We embarked on training all of our workforce on implicit bias because that was something that we needed to continue the education in this work. But then we also needed to be very concrete, right? So our goals needed to be around specific areas, so community equity and inclusion goals, and then equity and inclusion goals, right? How do we become a culturally responsive organization? And a lot of that is going to be in our training, in our development of affinity groups or of shared governance, so that it's not just lip service, it's actually how do they participate and be heard by administration as an organization. And our community perspective, and I mentioned how it is, I think that it is a journey, and recognizing that the most important thing that we have to do as an employer is to listen to our workforce. That perfectionism is the enemy of creation. Extreme self-solitude is the enemy of work. And I'd like to answer one of the questions that Maya posed. What can we as employers do to shore up our workforce? And I think it's really important that we listen and that we look and that we equip them to be whole. And with that, I apologize for the technical difficulties.
Thank you so much, Dr. Green. That was a great presentation. And we look forward to doing a little bit of Q&A at the end. We're going to bring up Sonia now for the next presentation. And Dr. Green, I would also just ask, in preparation for the Q&A, the audio for the most part leveled out, but it still was going in and out a bit through parts of the presentation. I would suggest maybe trying to leave the webinar and then coming back in, so we're all set for Q&A. Thank you. All right, Sonia, you're all set.
Okay, hello and welcome everyone. My name is Sonia Nunez and I am Imagine's Newark Program Manager. Just want to give you a brief overview of our services. We are a center for support. We do school and workplace response. We do training and education, and we have community webinars. Just a little bit about us. Our mission is to support children and families that are coping with loss, to foster resilience and emotional well-being for all those who are grieving. Also, our vision is to basically imagine a world where grief, trauma, and loss are transformed into resilience, empathy, and compassion, where children coping with loss grow up emotionally healthy and are able to lead meaningful and productive lives. And of course, where no one grieves alone. So at Imagine, we offer support groups that basically are not counseling or therapeutic sessions, because we believe that grief is not pathological, but rather a normal response to loss. We have volunteers who facilitate our groups and whose role is to provide a safe and supportive environment and space. And those are people who are basically grieving, and are the facilitators are people who, my apologies, who allow individuals who are grieving to share their stories and know that they're not alone. And we provide those services in English and in Spanish. We are located in Mountainside and Newark. And we have virtual and in-person options. Of course, we always invite individuals to come to our website, which I will put in the chat right now, just so you have it. Okay, and of course, after this presentation, you can schedule a tour to look at our facilities in Mountainside and in Newark. In Newark, we are right now renting space at the Boys and Girls Club at 1 Avon Avenue. And we also have an upcoming facilitator training if you want to be a volunteer. And it is June 2nd through the 4th. Let's see. Okay, and this is what our center looks like right now at Mountainside. And we basically have different spaces for all the different groups. Our ages start from 3 years old. We have groups from 3 to 5-year-olds, 6 to 9. We break them down by age, 10 to 12, 13 to 17, 18 to 28. As Rabbi Earl Groman said, grief is not a disorder, disease, or sign of weakness. It is an emotional, physical, and spiritual necessity. And it's the price you pay for love. But in addition to that, I mean, we also experience loss when it comes to like jobs, when it comes to moving places, even when you have an injury. We have all types of loss in our lives, but at Imagine, we of course support grief due to death. Grief is basically all the feelings you have about any loss that you experience, and it's painful and it's normal. And unfortunately, in the Black and Brown community is the elephant in the room because they don't want to talk about it. And in many cultures, that's a thing. You know, it's sad, but that, you know, we move on with grief, and that's not what we're supposed to do. We need to make sure that we are able to tap into our grief and be able to grieve at our pace. Grief has no expiration date. It comes in and out. And if we do not deal with our grief, it affects us emotionally, because after a grief, after a loss occurs and we do not deal with it, it changes us. And with that change, our experience of loss, you know, what we knew becomes different, and it throws us off, and we lose sense of security and our safety. We end up having grief bursts that can be activated by a memory, a song, a scent, because we never know when, you know, a grief burst will occur, excuse me. And also cognitively, if we do not deal with our grief, we're not able to return to work or school and concentrate and be the same for our employees, our colleagues, if we are dealing with children, for our children, and we call that grief brain. Physically, all age groups can experience somatic symptoms and notice a change in our sleeping and eating habits. Spiritually, individuals may stop or start questioning their spirituality and their beliefs. Relationally, we have impacts with our family, co-workers, and some changes that, you know, may develop because we have not dealt with our grief. You know, we're fighting with someone that has nothing to do with what we're feeling, but they're the ones who are there and we lash out at them because we haven't dealt with our grief. Our behavior changes sometimes, we're irritated, and young children act out in school. And so therefore, we really need to normalize grief and note that that is a feeling that we can, that we need to deal with on a daily basis and learn how to navigate through. So every day, excuse me, my apologies. Every day, people bring their grief into the workplace, which can be basically, as I said before, result in reduced productivity and basically strain employee relationships. So we at Imagine provide education and speak openly about grief with different you know, the schools, as we're training and as we're providing the grief support. We we provide ongoing consultation related to bereavement, and we do school responses if there's like a traumatic incident that occurs, someone dies in the workplace, and also in a school. We also cover program development where we design your bereavement policy with you. And if you have one, we review it and we assist you in making any revisions. If you don't have time for extensive workshops in your company. We offer lunchtime seminars that provide basic information about grief. And this can be one time or a series of seminar. And we also provide informational materials that basically are appropriate for individuals to manage grief in the workforce. And that, of course, you can find in our website. I do want to talk about a little bit of the process that we do when a participant calls the center. We, as the staff, take the call and we basically listen to what is happening with the individual and their families. We then conduct an orientation where we take them to the facility and we show them basically what happens at a night of support. And this is completely free for all our participants who come to our nights of support and need assistance with grieving. The only charge that we do are for basically training and education and for training in the workplace. For the facilitators that are holding the space for our grieving families, we provide a pre and post group. They come in and they unload whatever they need to unload before they go in and provide the safe space for our families. And then after they hear the heaviness, sometimes it's not, but if it is, they have the post group, which they will, basically it's for them to be able to unload anything before they go home, and leave it at the center and not bring it with them. As employees for Imagine, our job is very, very heavy. And so therefore we have space with each other. And we also, during our professional development, there's always some type of topic that is covered to help us, deal with our day-to-day. And we also get a lot of self-care, in addition to being able to celebrate our victories together. We take off birthdays, etc. And we, take care of each other at Imagine. And that's basically it in a nutshell. Thank you, guys.
Thank you, Sonia. So now we're going to bring on our final presenter, Courtney Gassion, partner member at Chiesa Shahini and GM Tomasi.
Good morning, everybody. As Maya said, my name is Courtney Gassion. I am with CSG, as we like to call it. I am in their employment law group. We are responsible in our group for representing employers, businesses in employment-related matters, both litigation and in the counseling sessions that we provide to employers to help them deal with employee and workplace issues. So what I'm going to be presenting to you today is really a condensed version of what we would do in a more robust training for some of our clients as it relates to disabilities in the workplace, mental health being one of those types of disabilities. And I'm going to give you the legal perspective on addressing mental health in the workplace. So far, we've heard throughout the morning some perspectives from many different speakers as it relates to proactive steps that can be taken in the workforce to deal with mental illness and mental health issues. We've talked already about providing access to employees, giving them support systems in place. Laura talked quite a bit about EAPs and what that looks like in an employment setting, and the type of benefits that human resource departments can provide through different resources such as telehealth. There's apps that can be utilized, having workplace initiatives such as yoga and things along those lines are all really helpful in addressing mental health of employees on site. However, from an employer's perspective, there's also going to be issues that you have to deal with in the event that when the mental health issues are now impacting the employee's ability to do their job. And that's where the legal perspective comes in. There can be many pitfalls in dealing with employee issues regarding mental health. They can be fraught with risks and potential legal liabilities for employers. And that's often when we come into the process to help guide employers through and navigate these types of situations. There are both federal and state laws that address accommodations and disabilities in the workplace. So we'll talk a bit about those first. If you have an employee in the workplace and it appears that that employee, either they first come to you and identify that they have a mental health issue, or it is objectively obvious to the employer that there is something going on with the employee, then there's going to be a process that gets triggered as a result of one of those two scenarios happening. So under the federal law, the American with Disabilities Act does protect employees with mental illnesses. The ADA applies to employers that have 15 or more employees. And the ADA defines an individual with a disability as a person with a physical or mental impairment that substantially limits one or more life activity. There also can be a record of such disability or is regarded as having such an impairment. So that means even if the employee doesn't currently have a disability under the ADA, if they have a record or a history of having a disability, they are still going to be protected under the American with Disabilities Act. What is a major life activity? That's kind of a key component in defining whether or not an individual is going to be covered and protected by the ADA. And a major life activity are things such as eating or sleeping, going to work every day, being able to concentrate, being able to communicate with others, and being able to regulate your thoughts and emotions. So if things of that nature are impacted by a person's impairment, then they are most likely going to be considered to have a disability and therefore protected under the federal law. Some of the mental health disorders currently that are recognized, this is not an exhaustive list, but some that are currently covered by the ADA are post-traumatic stress disorder, obsessive compulsive disorder, schizophrenia, bipolar disorder, major depressive disorder, anxiety, personality disorders, and some addiction issues may also be covered under the ADA, depending on the circumstances, both alcohol and drug addiction, but there are certain qualifiers that must be met in order for an employee to be covered under the ADA. Since we're in New Jersey, I'll just talk briefly about what New Jersey law requires. In New Jersey, employers and employees are covered by the New Jersey LAD, that's the law against discrimination. In the case of the ADA, as I mentioned, that it applies to employers that have 15 or more employees. NJLAD actually applies to all employers, and that's both in the private and public sector. So disabilities under the New Jersey LAD are defined as including any mental, psychological, or developmental disability that results from a condition that prevents the normal exercise of any bodily or mental function, or which can be shown to exist through accepted clinical or laboratory diagnostic tests. Okay, it prohibits, as does the ADA, discrimination based on any of those characteristics in hiring, firing, pay, or compensation of employees. Okay, so under both the ADA and under the NJLAD, employers do have obligations to their employees that may present with a mental health illness that qualifies them under one of those two laws. The employers, and this is just kind of an initial statement, and then we're going to kind of walk it back as we go through the accommodation process, but generally speaking, employers are not obligated to hire employees or retain employees that cannot perform the essential functions of their job, or where there is a direct threat to safety of either themselves or to other employees in the workplace. Okay. However, and this is the very big caveat, before an employer can reject an employee from the hiring process or terminate an employee, the employer must determine whether or not the employee can or cannot perform their job duties without a reasonable accommodation. Okay, so this really kind of becomes the key factor, and the employer has to make a determination on whether or not the job can be performed without an accommodation. If it can be performed without an accommodation, then there's no issue. If it can't be performed without an accommodation, then the employer can go ahead and make their employment decisions accordingly. However, if there's accommodations that can be given to the employee, that's when we start going through what's called the interactive process. So we're going to talk a bit about that next. So let's talk about what a reasonable accommodation looks like. And a reasonable accommodation removes workplace barriers for individuals with disabilities. Okay. And whenever you talk about accommodations, we're talking about the employer allowing the employee the ability to perform their job, but giving them some kind of tool to access everything that they need in order to perform their job appropriately, perform the essential functions of their jobs. Okay. The accommodation process often gets triggered. And for those employers out there and those of you running businesses, most often you're going to see the scenario where an employee rather comes forward and says, I need a workplace accommodation, or I have a disability and I need an accommodation to address it. That does not necessarily have to be the trigger. Employees are not required under the ADA or NJLAD to submit an actual request for an accommodation. However, we do always recommend to our clients, both small and large businesses, that they have a policy in place where any request for an accommodation, whether it's mental health or a physical disability, should be placed in writing. It helps make the process cleaner, helps keep a very good track record. And I'll talk a little bit towards the end of my presentation just about the documentation process that should be happening. So having the first initial request come in through a written request is always something that we consider to be a best practice. It's important to note that a request for an accommodation for a mental health issue can come at any time during an employee's employment. It can come when they start. It can come after they're there for 6 months. Even if they've had the condition for those 6 months, it can happen after 10 years of employment, even if their mental health status has not changed over that course of time. So it's really up to the employee when they want to trigger the request. Okay. There can also be circumstances, and I do just give a word of caution when it comes to mental health issues, because they can be a little bit hard to discern because it's not necessarily an overt physical disability that you're looking at. But there can be circumstances when there is objective evidence that's observed by the employer, where the employer may actually approach the employee to inquire about whether or not they require an accommodation to address a mental health disability. As I said, we always issue this with a bit of caution. It's different when you're dealing with a physical disability that is very obvious, such as say somebody is in a wheelchair and they may require access accommodations. It's not so easy to objectively identify a mental health issue. But there may be certain circumstances where an employer is able to objectively identify a mental health illness in an employee. We would recommend, though, before approaching an employee, that you consult with counsel, or at the very least your human resources department, before going ahead and initiating the conversation with the employee. If the employee is the one making the request, or even just having a conversation with the employer about a disability, they don't need to use the word accommodation. They don't need to use the word disability. They can simply be conveying information to the employer about an issue that they are dealing with. Okay, so something as straightforward as, I've been suffering from panic attacks lately. It really makes me uncomfortable working in groups. Okay, that may be, although not necessarily overtly clear, a request for an accommodation. The employee could be telling you as their employer, it's no longer comfortable for me to be in a group presentation setting, or I am no longer comfortable being in group meetings. So that may require the employer to go ahead and now interact with the employee on whether or not they need an accommodation to help them perform the essential function of their job without having to go into a group setting. Another example would be somebody who expresses to a supervisor, a manager, and they say, I've been suffering, I've been depressed lately, and it's really making it hard for me to get up in the morning and get to work on time. Okay, so that can be another example of an employee not using the word disability, not using the word accommodation, but still the underlying information that the employer is getting is that there may in fact be a disability there, a depressive disorder. Again, it would have to be diagnosed, and that is impacting the employee's ability to get it to work on time. And the employer may now have to accommodate the employee to say, we can modify the start time for you, for your schedule to allow you to get into work a little bit later. Those are just two examples that I give. There's an endless list of examples, and certainly if there's any questions, you can throw those in the chat. The interactive process is what gets triggered after these types of conversations take place. So either the employees come forward and said, I overtly need an accommodation, and this is the accommodation I need, or the employer has recognized it on their own, or there's been one of those more casual conversations I mentioned where there is a dialogue that gets triggered as a result of the discussions that have been had, and some of the key words that employers should be on the lookout for, such as the examples I gave. The interactive process that I keep referring to is essentially communication between the employer and the employee about whether the employer requires an accommodation to perform their job. And if so, what does the accommodation look like? Okay. It's important to underscore that employers are only required to give a reasonable accommodation. And a reasonable accommodation is one that does not cause a significant or undue hardship on the employer. The undue hardship can come in the shape of an excessive cost. So it could have a financial impact on the employer. If that creates an undue hardship on the business, then it's not a reasonable accommodation. If it causes a disruption in the business operations of the employer, it also is not a reasonable accommodation. So those are factors that have to be looked at when an employer is making a determination of whether they can in fact accommodate an employee. The interactive process is really about gathering information. That includes medical documentation. Employers may require that employees submit medical documentation as it relates to accommodation requests. They're also able to seek clarification on the medical diagnosis, as well as any particular accommodation the medical provider recommends for the employee. Employees are, and in fact, oftentimes supported and encouraged to make requests for specific accommodations. That helps the employer through the process, but the employer is not necessarily obligated to give the exact accommodation the employee is asking for. So that's really what the interactive process is about, is the two parties coming together and having a dialogue about what the accommodation will look at. It might not be exactly what the employee wanted. It might not be exactly what the employer's first initial offering was, but at some point they try to come together to get to the point where both sides are able to move forward. The employee can perform their job and the employer can provide the accommodation so the employee can proceed. It should be an open communication, and the employee should be forthright about what they need to get their job done. And at the same time, the employer has to be sure that it's not overly burdensome on their operations. Likewise, the employee is not obligated to take the accommodation that is offered by their employer, but they have to understand that there is some risk involved if they don't accept accommodations that are offered. So that's why it is always advantageous for both parties to try to come together through that interactive process. Documentation is very important. This is something we underscore with all of our clients. The initial request that comes in, as I mentioned before, we always suggest that be in writing. Medical documentation is absolutely necessary and should be documented and placed in the file. Any communication through the interactive process should be documented. Even if you're having a verbal conversation with the employee, that should be all documented and kept in this accommodation file. Whatever accommodations are requested and offered by the employer should also be documented. if an accommodation request is rejected, that should also be documented. And what's very important is the final determination that's made, what the accommodation will be, if they've accepted what the employee is seeking, if they've made a modification to it, or if they've ultimately rejected it. That should all be documented, and the employee has a right to have documented in a written form why their accommodation request was rejected, and why it was rejected, or if it was in fact accepted and they're getting the accommodation. It is prohibited under law for an employer to retaliate against an employee just by virtue of making a request for an accommodation. And they are under both the ADA and NJLAD prohibited from discriminating against an employee who is either disabled or currently utilizing an accommodation in the workplace. It's also important that employees try to apply their policies standard across the board. They don't disparately treat employees, and if they have similar requests for accommodation from employees, as long as their job functions are similar and both can perform their jobs with that same accommodation, they should be even-handed and be willing to give the same accommodations to employees throughout the workforce. And when dealing with the application process, it is important that when you're interviewing employees, to remember that before a conditional offer of employment is made, you cannot ask an employee whether or not they need an accommodation for the job that they are interviewing for. After a conditional offer of employment is made, there can then be a discussion and inquiry by the employer of whether or not the employee needs an accommodation in order to start the new job, but that's only after that job offer has been made. All of this documentation that I'm talking about is essential in protecting employers as well as employees. It's also equally as important for employers to have policies in place that address the accommodation process, how to request an accommodation, who they should go to request accommodations. If there's any forms the employer is using, they should be included in their policies as well. And it's exceptionally important that employees are given access to that upon their start of employment. We also recommend as a best practice that going through the interactive process is limited to either HR personnel or somebody on the management team. I know there may be some small businesses on the call today that maybe don't have a large HR team, or maybe they don't even have a designated HR individual. So then we do recommend that it be somebody in the executive team or on the management team that handles these accommodation requests. We try to steer employers away from having frontline supervisors and managers deal with accommodation type requests because of the confidential nature of the medical information that's being provided, and the information that is provided, both the request for the accommodation and any medical documentation that's provided, as well as the interaction between the employer and employee through the interactive process, is all considered confidential. So very important to remember that the group that has access to that should be kept very small. I'm gonna just got the signal to try to wrap up. The last thing I just want to address is that if it is determined that the employee is not eligible for a reasonable accommodation, or it's an undue burden on the employer, the other options that the employer must look at is possible leave options. That would be either a paid leave using paid time off, a leave under the ADA, or under the FMLA, which is an analysis that the employer will have to do to identify whether or not the employee has other options available to them without the reasonable accommodation, to take some time off from work to deal with the mental health issue. And then finally, there are resources available, especially for some small employers. I'm happy to put some resource links in the chat if anybody is interested, both for outsourcing of HR, through different opportunities that consultants offer, as well as some online resources that some different societies and foundations offer for managing HR issues, including disability accommodations in the mental health realm through online platforms. Thank you for your time, and I appreciate the opportunity to be here.
Thank you so much, Courtney, and thank you to all of our speakers for presenting today. I want to invite everyone to come back on camera. We are cutting it very close to time. We're just going to do a quick couple of questions that we've prepared beforehand for the audience. And again, if there are any questions about the presentations, we have a couple of minutes if someone wants to drop that quickly into the chat. You're also welcome to follow up with myself or other members of the NRBP staff if you have questions, and we'll make sure that those get to the appropriate speaker. So do I have all of my, okay, Laura and Courtney, will you come back on camera? Perfect. Thank you. So a lot of your presentations kind of touched upon certain aspects of the questions that I had prepared already, which is great. I actually have a question that I want to throw in because I just want to make sure that we're definitely kind of getting to the unique and specific needs of our small business members. And Courtney, you were really going into that towards the end of the program. We will be sharing some resource links in the post-event thank you email, but I did just want to give all of our speakers the opportunity to share a resource or two that they think might be helpful specific to small businesses. And when I talk about small businesses, I mean going from, you know, solopreneurs, people who are by themselves, or maybe only have a staff of like 2, 3, or 4, family-owned businesses. That's actually probably a very unique and interesting dynamic in terms of mental health and work-life balance. People who are, you know, maybe retail business owners, although we don't have a lot of those people in our membership, they too face a lot of these mental health needs as well. So I really just want to kind of share quickly some resources that are relevant to our small businesses and companies that don't have as many resources as some of the mid-size and larger entities. And we'll start with Dr. Green, and I'll just kind of call everyone out as I see you on my screen.
I'm hoping my audio is better this time. How are we doing?
So far, so good.
Excellent, excellent. So what I would say to small businesses and is to your employees, right? Be able to hear what's important to them, what their concerns are. They can sometimes be a really good resource in how to improve your business because they understand sort of the mission, what you're trying to accomplish. It can be a much more engaged employee. You know, I think leadership development is always an important thing. Is this a job where they can see something growing, learning more or growing more? So never neglecting the opportunity to connect your employees to how can they grow? How can they excel as a person? I think it's important.
Awesome, thank you. Sonia, any specific tips or resources for small business owners?
Just to make sure that you provide the safe and supportive space that your employees and community need to be able to deal with grief, just so we can have individuals that are available to work and be there for each other. So always Imagine is there to support businesses and the community.
Great, thank you. Rachel?
Sure, just to echo that, no company is too small to promote a culture of kindness and acceptance, and that comes really from, you know, within and all of us. So that's important to make sure that, you know, it's okay to not be okay. And there are lots of different types of evidence-based free resources available on different mental health conditions that you can find online. If a company is small and not able to pay for things, you know, they can direct their members there or employees there.
Great, thank you. Courtney, back to you, though. You might have already said what you have to say on this, but coming back to you.
So I just put it in the chat. I put the link in the chat. The one resource I was specifically thinking about is there's something we utilize a lot as employment lawyers is an organization called SHRM. It's the Society for Human Resources Management. So they have wonderful resources. It's an online platform, and in July of 2020 they actually launched a mental health wellness in the workplace for employers. It's an online forum for employers to help professionals through education and training. So I just put that link in the chat. And I think that it's especially nonprofits and small businesses will find that a useful tool.
Great, thank you. And Laura?
Okay, so I guess the one big takeaway I would want people to know, employers when they're working with their employees, that behavioral health is a dynamic health status. It's not static. It doesn't happen all at once, or it's there or it's gone. So understand your employees' behavioral health as a spectrum. And it's something that you can check in with regularly, and don't assume a diagnosis. But when an employee comes to you asking for assistance, know a local and accessible resource that you can share a number and not feel that you don't have anything to offer. That includes for their children. And in New Jersey, there is a system of care called Perform Care, and all children under the age of 21 can access Perform Care services. It needs to be initiated by the parent. So I think even giving your employee who's the parent of a minor that sort of information takes the burden off of them to have to try to figure out where to go.
Great. Thank you so much, Laura. So we are going to end the program now, try to just be mindful of everyone's time, and we're going to bring in our president, Chip Halleck, to close us out. We're really happy that everyone joined us today.
Thanks, Maya, and thanks for doing such a great job. Thanks, Maya, and thanks for doing such a great job of organizing the panel and running it today on so many fronts. I couldn't begin to summarize this discussion this morning. It's been fabulous. If I had to have two takeaways, it's just that we're driven home by all of you is the tremendous impact and the high rate of incidence of mental illness in society today. And the second thing is simply find a way to deal with it. And I think you folks did a great job of outlining resources and steps that our members can take in order to address the challenges of some of their employees. So I can't thank you enough. I'm very proud of an organization that has this kind of expertise and this kind of talent and willingness to share with our members to help their employees and their families live better lives. So with that, I thank you. We're very grateful to RWJ Barnabas Health for sponsoring this eye-opener series of programs, Horizon Blue Cross Blue Shield for sponsoring this event, and our media sponsors, New Jersey Advanced Media. And thank all of you. You've been a tremendous resource and will continue to be as this program has been recorded and will be available for other members to see. So thank you once again from the bottom of our hearts for doing such a great job this morning.